if we start to look into the muscles that move the pectoral girdle, we'll start with the subclavius muscle. If you think about subclavius, sub, below, clavius, clavicle, this muscle right here is the subclavius muscle. So the subclavius muscle. Now, the subclavius muscle, as far as action, is going to help to stabilize the pectoral girdle. So the subclavius muscle is going to help stabilize the pectoral girdle. Next muscle up is pectoralis minor. This muscle coming down is pectoralis minor. Now, we have the arm is removed currently, but if we put the arm back in, you're going to notice how pectoralis minor goes right up towards the shoulder. So pectoralis minor. The action of pectoralis minor is when the ribs are fixed, it draws the scapula downward and forward. So basically take the scapula, pull it downward and forward. Pectoralis minor. Now we're going to take the arm away again. So removing the arm. And we're going to look at serratus anterior. This muscle is going to be serratus anterior. If you think of the term serratus or serrated, these are the serrated edges right here, coming up and down off the rib cage. Now remember, these are deep. They're deeper to the pectoralis minor, which is even deeper to the pectoralis major, which is over here. So this is serratus anterior. You can see it runs all the way to the back here. Serratus anterior. Now the action is rotation of the scapula, so it's inferior angle. Remember we did the anatomy of the bones, so that very bottom point. So the inferior angle moves laterally and upward. So serratus anterior will take that inferior angle of the scapula, move it lateral and up. If we continue on to the next muscle in our grouping we're talking about, we're looking at the trapezius. Now, the trapezius is on the posterior side. It's more of a superficial muscle. This is going to be the trapezius. For the trapezius muscle, we're going to look at the origin, the insertion, action, and innervation. So the origin of trapezius, it'll start up here on the occipital bone. It'll then also have origins off the ligamentum nuchae and off the spinous processes, coming down here, spinous processes of C7, so cervical 7, all the way through thoracic 12. All this origin comes over and inserts into the acromion process, right at the top of the shoulder, the scapular spine, and if we turn this a little bit, we'll be able to notice it even wraps around the front a little bit to come into the lateral third of the clavicle. So we have insertions of clavicle, scapular spine, and the acromion. Now the action of trapezius, well, it really depends on what part of the muscle you're looking at. But some of the actions are to stabilize, elevate, it can retract, it can rotate the scapula. So it all depends, are the muscle fibers pulling up for elevation or the muscle fibers pulling down? So we're looking at several different actions there. Stabilization, we're looking at elevation, retraction, and rotation. Now the innervation for the trapezius muscle is going to be the accessory nerve. Sometimes it's also called the spinal accessory nerve. Moving along, we'll look at the Levator Scapulae next. Now, Levator Scapulae, think about the term levator. Well, levitates or elevates the scapula, which means we need to add the arm back in again. So if we're taking this arm and putting it back in, you can notice that this muscle right here is Levator Scapulae. It would help to attach and elevate the scapula. So the action is elevate scapula. Levator Scapulae. The next two muscles are actually a grouping. They're called the rhomboids. We have rhomboids major, rhomboids minor. Now, the two rhomboids, they both are going to originate from the vertebral column. Right here is the rhomboideus minor. The larger one is rhomboideus major. Rhomboideus minor is going to originate from cervical 7, so C7, and T1, thoracic 1. While rhomboideus major is originating from T2 through T5, thoracic vertebrae number 2 through thoracic vertebrae number 5. But the nice thing is both of these have the same insertion. They both insert into the medial border of the scapula, which means they also share the same action. The main action of the rhomboids, so the major and minor, are going to be to stabilize the scapula. Stabilize the scapula. And the innervation, we're looking at the dorsal scapular nerve. So innervation, dorsal scapular nerve. So rhomboideus minor is a little smaller and superficial. Rhomboideus major is a little larger and more inferior.